Did you know that experienced cardiologists can identify and diagnose certain heart diseases just by looking at visible physical indicators on your hands? Unfortunately, over the past several weeks, I've been seeing many comments from people who have serious heart problems but simply can't afford to see a doctor or get treatment. And I can clearly tell from their detailed personal messages that they really need to see a medical professional immediately. This issue has really bothered me, but I try to teach things that can help you figure out whether your heart problem is serious or not. If, according to the detailed explanations I have shared, your specific heart-related health concerns seem serious, it is very important that you make an effort to consult a cardiologist by any means possible for a professional evaluation. Hello everyone, and welcome back to the Dr. Khoob YouTube channel. In this video, I would like to introduce 5 signs to you that, God forbid, if you have them, they could indicate a serious underlying heart problem. Let's start by looking at the very first sign, a painful swelling of the finger. These specific lumps on the fingers, especially those found at the sensitive fingertips that appear pinkish purple and are quite painful, are known as Osler's nodes. These small lumps can be a clear clinical sign of infectious endocarditis. This is a serious condition, which means that the inner layer of the heart has become infected by harmful bacteria. This condition represents a serious inflammation that has impacted your cardiovascular system. Bacterial infections that spread to your heart and blood vessels can lead to endocarditis or a severe infection of the inner layer of the heart. If you notice painful lumps on your fingers, you shouldn't ignore them, because ignoring them could cause irreversible damage to your vital heart. These lumps are known as Osler's nodes, which are formed as a direct result of significant inflammation in the small blood vessels of your body. These lead to a bacterial infection in the dermis, or the thick middle layer of the skin, which triggers increased levels of inflammation in the cardiovascular system. Osler's nodes may fade away and disappear on their own after a few days, but that doesn't mean they're harmless or that the underlying danger has passed. If you have reason to suspect that the small, painful lumps appearing on your fingers are Osler's nodes, you should promptly see a medical doctor for a formal biopsy, which involves taking a small skin sample for testing. You can also consult with a specialist cardiologist to determine whether these specific bumps are directly related to an underlying heart condition. The second important sign to watch for is the appearance of brownish red or dark purple lines on the fingernails. These distinct red or purple lines found under your nails are common clinical signs of splinter hemorrhages, which is essentially bleeding that occurs deep beneath the nail bed. This medical condition is specifically triggered by damage to the tiny blood vessels located under the nails and can be a potential clinical indication of heart-related problems. According to the American Academy of Dermatology, bleeding that occurs under the nails, if accompanied by a significant fever and an irregular heartbeat, can be a clear sign of serious underlying cardiovascular disease. The sudden appearance of multiple lines on your fingernails can often indicate a potentially very serious and significant underlying health problem. These lines under the nails occur due to minor internal bleeding and leakage within the tiny blood vessels present in the nail bed, which can result from direct physical trauma to the hand or a bacterial infection that has spread through the bloodstream to your entire cardiovascular system and heart. The third clinical sign is the clubbing of the fingernails. I talked about this sign in another video. You may have never heard of the term clubbed nails before, but you should definitely know that it is a very frequently occurring medical condition. People with clubbed nails typically experience noticeably enlarged and widened fingernails, an unusually soft nail bed, and nails that gradually curve in a downward direction. This condition usually occurs when blood oxygen levels drop. One of the primary and most serious causes of clubbed nails is infectious endocarditis, which is a bacterial infection that targets the inner lining of the heart chambers and the heart valves. While this specific medical condition can be common in people with congenital defects, it can also frequently occur as a result of chronic heart disease, rheumatoid arthritis, and advanced lung disease. If clubbing of the fingernails is the direct result of heart disease, the symptoms usually start with the thumb and index finger, slowly and steadily progress over time, and eventually involve the other fingers as well. However, after treating the underlying cause, it can be successfully and easily resolved. For example, if we compensate for the lack of oxygen and the patient is hospitalized and receives adequate oxygen, this problem usually resolves gradually as well. If you notice that your fingernails have become raised or clubbed, you should consult a medical professional as soon as possible. The fourth sign involves weakness in the hands, persistent tingling sensations, and waxy fingers. Amyloidosis is a rare disease characterized by chronic numbness, intense pain, physical weakness, and waxy bumps on the hands. These symptoms occur because of the abnormal accumulation of a specific misfolded protein known as amyloid, which can build up within the body's various tissues. As these abnormal amyloid protein deposits progressively increase within the heart tissue, they gradually replace the healthy heart muscle, eventually leading to a serious condition known as cardiac amyloidosis. This specific medical condition disrupts the proper functioning of the heart and may lead to significant health complications in the cardiovascular cells and heart rhythm, potentially causing you to experience abnormal heartbeats that can feel irregular or unusually rapid. Cardiac amyloidosis significantly restricts the overall volume of blood flowing to the heart and consequently results in a much slower and less efficient circulation of blood throughout the rest of the entire human body. Since your overall blood flow is significantly reduced, the actual amount of oxygen reaching your hands also decreases, which can make your hands look waxy, feel painful, and cause you to experience a sense of weakness in them. If you notice any of these concerning symptoms in your hands, you should contact your doctor without any delay because your heart health may be at risk. The last sign to look for is colored spots on the palms. Painless bluish or brownish spots on the palms create specific medical lesions known as Janeway lesions, which are important indicators of your condition. This medical condition is caused by blood clots containing bacteria, which are scientifically referred to as septic emboli, and it subsequently results in an infection throughout the circulatory system. Janeway lesions develop and spread with rapidity, often within just a few days, and then they fade away and vanish. This means that the vast majority of affected individuals don't even notice when they first appear. For this very important reason, as soon as you notice any unusual discoloration on your palms, you should immediately consult your doctor to determine if these lesions are due to a heart problem or not. Keep in mind that 80% of heart-related problems can be effectively prevented by avoiding harmful foods. I have explained ways to strengthen the heart in detail in a separate video, which will be shown here as a suggested video. I highly recommend you watch those informative videos as well. I hope you always stay healthy and well. If you have any questions, leave a comment. I am sincerely here to answer you, dear friends. May God be with you.